tell us your name?
Beverly Hancock. So I spent most of my childhood growing up in a suburb of Chicago. I did have 1 year that my family had the opportunity to live in Germany. My dad was a professor and took a sabbatical leave to study there. At that point in time, people didn't travel a lot around the world, and so it was a really impactful year for me. I was young, I went to a German school, I was fluent in German by the end, and I came home understanding more about the world and people and differences. My mother had also, in the 1950s, lived in the rainforest of Ecuador. That also enlarged my understanding of diversity and needs in the world, and so I grew up with kind of that perspective, even though I was in a suburb of Chicago. My mother was widowed when she was very young with her first husband, and it was a traumatic event. And then she married my father, and he was both a professor and a pastor. And together, they engaged with people who were grieving and suffering. And so I observed that as a child and saw that life can hurt, pain is real, people die, and that you can be with them in that, in their suffering and pain. And so understanding, just listening and caring was a significant thing that I observed with my parents. Being a nurse is an identity. It is, I don't do nursing, I am a nurse. And I think that's something that takes a while to recognize, is that it is what we are. We are a nurse, and that's something that you carry everywhere that you are. That's why in airplanes, when there's a medical emergency, nurses and physicians respond to that because we carry that obligation as a professional. But it's something that I've woven into many different things, whether it's participating in career fairs at my kids' schools, or I had the opportunity to start a wellness program, not-for-profit senior center for low-income multi-ethnic seniors in Chicago, to be able to provide services to them and bring health education that to impact the health of the community. So in whatever space I've been in, I've been able to use my nursing. Certainly as a mother, it's been very practical to have, and caring for other family members. Also, there are things that you learn in nursing that are not just the health things, but very practical skills. Nurses have excellent assessment skills, also problem-solving skills. And so those are useful in so many different areas. We've been really encouraging nurses to be on boards, to bring that knowledge, that expertise, and just the discernment that we have as nurses. It's what do you do with the information you have? So can you see what's going on, and then what do you do with that? They're critical skills to being a nurse, to be able to discern what is happening with this person. Have been involved in nursing leadership for a number of years now and helping develop nurses as leaders. And those same skills are really important to that role. You're not assessing patients, but you're assessing what's going on with the team that you work with. What is the system, and how do we solve problems within the system? And so your focus is different, but it's the same skills. A significant part of what refuels me are the people that I get to engage with. So whether it is the team that I'm working with, people that are participants in our programs at AONL in particular, loved being with the AONL fellowship participants and spending a year with them. And watching people grow as you're engaged with them is just, it's so satisfying. That work is what refuels me. It's a good experience to take time to pause. And when you're in each day, you sometimes don't see the progress forward. But when you stop and look back on, for me, 12 years of work, it reminds me of what an honor it is to be in this work. Nursing is the opportunities are incredible, and the flexibility of not just in being able to have different clinical areas that you might work with, but the different roles. I've had so many different roles in nursing that have been meaningful, and opportunities that have been enriching. And that's what I hope for every nurse, is that they can realize the potential that they have to do meaningful things in so many different ways within nursing. It has just been a rich career for me. I have to stop because I will cry.